Alright, so I'm at the nurse's station performing my second med check. So I have Mr. Ferdinand Foley, date of birth 9/23/69. Mr. Foley has no allergies. He has been ordered ampicillin 0.5 grams IM every 6 hours to be given at 1200. Pharmacy sent up my ampicillin, which matches my order. It has an expiration date of October of 25, so it's within its expiration date. It's good to use. Since my dosage on my vial did not match what was ordered, I did some drug calculations, and Mr. Foley is going to be receiving 2 mils of ampicillin. So I'm going to go ahead and get that drawn up. I'm going to take my alcohol swab, and I'm going to clean the top of my vial. While that's drying, I'm going to allow it to dry, but while it's drying, I'm going to go ahead and take my syringe here, and I'm going to apply a blunt tip needle. So with that being applied, I'm going to go ahead and draw up my 2 mils of air, which I have, right here. I'm going to inject that into my vial. So I'm going to push my air in. I'm going to invert my vial, and I'm going, to aspirate my 2 mils of ampicillin, ensuring that there's no bubbles, and there's no bubbles. So I'm going to go ahead and make sure we have 2 mils. I'm going to go ahead and recap my needle. And I'm going to show you, I have my 2 mils right here. So now I'm going to go ahead and perform my third medication check. So I have Ferdinand Foley, date of birth 9/23/69, no allergies. I'm going to be given ampicillin. He's going to be receiving 2 mils, which I have already in my syringe. He's going to receive this intramuscular and at 1200. With this being a multi-dose vial, we don't take it to the room, so it's going to go back to the Pyxis. All right, so now I'm going to go ahead and remove my blunt tip, and I'm going to switch it out for an appropriate needle. So I'm going to remove this. I'm going to go ahead and take my needle and, attach it on there. So I'm going to go ahead and create my label. So I have ampicillin, 2 mils, to be given at 1200, today's date, which is 4/21/25, and my initials. And I'm going to attach that to my syringe here. And then I'm going to go ahead and initial right next to the 1200 on my MR, stating that I went ahead and prepared this. So, that being said, I'm ready to go to the patient's room. So, knock, 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 entering my room, providing privacy, hand hygiene. Hi, my name is Samantha. I'm going to be given your ampicillin injection this afternoon. Can you tell me your name and date of birth, please? Ferdinand Foley, 9/23/69. Ferdinand Foley, 9/23/69. Matches my MAR, matches his bracelet. Mr. Foley, do you have any allergies? No known allergies. No allergies, matches my MAR, matches my bracelet. So we're good to go there. So now I'm going to go ahead and scan his bracelet. Beep. I'm going to go ahead and scan my label. Beep. And with that being said, I'm going to go ahead and apply gloves. So for an IM injection, we want to avoid any bony prominences, any hard areas, any skin tenderness, any redness, any non-intact skin. And for an IM injection, we can give it in one of 3 places. We can do the deltoid, which is 1 to 2 inches below the acromion process. We can do the ventrogluteal, which is between the greater trochanter and the iliac crest. Or we can do the vastus lateralis, which is hand width below the greater trochanter and hand width above the knee. Since we have a 2-minute injection, we can't use the deltoid, so for Mr. Foley, I'm going to go ahead and use his ventrogluteal area. So I'm going to go ahead, I got his skin ready to go. So I'm going to take my alcohol, and I'm going to cleanse the site. Excuse me, I have an itch. Cleanse the site, starting in the middle and going out 1 to 2 inches in a circular motion. I'm going to allow this to dry, and while I'm letting this dry, I'm going to go ahead and remove my needle cap here. So we want to pull the skin down or to one side, and we want to hold it nice and taut. So I have his skin pulled down. IM injections go at 90 degrees, so I'm going in at a 90-degree angle. I want to inject this medication slowly And then we want to hold it for 10 seconds. Once that 10 seconds it's up, I'm going to go ahead and remove my needle, and I'm going to release the skin at the same time, just ensuring that the muscles are getting folded back over. I'm going to go ahead and engage my safety device here. And I'm going to take a gauze, and I'm just going to gently blot it. I don't want to massage it or apply pressure because that could mess up that medication. With that being said, I'm going to go ahead and discard this in the sharps container here. So walking over here into the sharps. I'm going to go ahead and remove my gloves. I'm going to ensure Mr. Foley has no other needs. Ensure that his bed is in a low locked position, both side rows up, call light within reach, and Mr. Foley is good. So I'm going to go ahead and take my MAR here, and I'm going to write that I administered this medication in the left ventrogluteal area. I'm going to cross through my time stating that I gave it. And this is my MAR. And that is time.